So what was the first big goal you achieved and that let you know you were on the right track? And why was this significant to you? If you can think of something.
Sure. I would say the one of the most exciting moments. Um, well, my big goal is, it's not quite there yet. Ironically, it's only been 6 months of practice. How quick can it happen? But I'll tell you the big goal, and then I'll tell you the small goal. So the big goal is to create levels in an office in the city, hopefully the one I'm at right now, where the whole bottom level is all called Forster food, like a grocery store, and it's all Forster food of all the healthy ingredients that test well on patients. The second level is all the type of treatment. The third level is all the rehabilitation where I get a professional. And the idea is I want to, there's so many specialties in the chiropractic profession: ART, Graston, Activator, R2P, Applied Kinesis. There's just so many, so many, so many. NET, functional medicine practitioner, that I would love to have a professional specialty under every single aspect of every single room. So when a patient comes in, depending on what they need, there's a specialist there for it. So that's kind of the dream of mine. And but the small dream that happened was that first day where I was completely scheduled from the minute I got into the minute I leave. And the reason I say that is because I said before, it's a cash-based practice. And when something's cash-based and not insurance, it's kind of the idea you put your money where your mouth is, that a patient will see you and is willing to spend the money if they find the value in what you provide.
Absolutely.
However, it's a tryout. At the end of the day, it's a tryout. And if you don't put results, they're not going to keep coming and spending their time and money. And granted, I charge at the moment, starting from year one, I'm charging $230 for the initial, and then 110 after, and that's not including the supplementations and thus forth on top of it. So a patient could be spending anywhere between $400 and $500 in that moment of life. So it's one of those things where, to know that I was booked out from the minute I got into the office to the minute I left, and to the point that I got booked out a month and a half, knowing that I charged very well for my first 6 months, my first year ever in practice, really was a goal of mine, because it showed that you can have the third generation name and the license or whatever, but at the end of the day, when there's a patient on your table, what are you going to do about it?
Right.
Right? There's no one here to save you. There's no one who's going to do it for you, and you can't hide behind any kind of letters or any kind of reputation. They're suffering, they're in pain, the baby's crying. There's two patients in the waiting room. What are you going to do about it, and how are you going to help, and what kind of difference you're going to make? And are they going to message you a week later, thank God you were my messenger doctor because you were blah, blah, blah. Or, I'm sorry, but it's been 3 visits and I haven't seen one result. So to me, to know that I'm putting up the results, to know that I was booked out that first time when I came back from Costa Rica, and to know that it only elevated from there. And I would go to the city office with 0 patients, and now I have 7 patients today, is just showing that that is a wonderful goal, because that means I'm actually doctoring in this world.
That's great.